My name is Dr. Zwelling, Marcy Zwelling, and I'm talking to you from Long Beach, California. Thank you for coming to Clinical Notebook. I appreciate the support. This is a video library website, and I invite you to look through the site after you see this video. I'd like to talk to you today about the flu vaccine. You know, people are clamoring for the flu vaccine. It's not that expensive, but $25 is not nothing. People are leaving school and leaving their place of work to go get a flu vaccine. How important is that? What does it really do for us? Well, you may be surprised that when you look at the literature, not everybody gets the flu, even when they're exposed to it. In fact, studies show that among healthy adults, somewhere between 4 and 13%, depending upon the study, might get the flu. What happens when you get the flu vaccine? Well, some people still get the flu. First of all, the studies only apply to those people who get the right flu vaccine, and that means that our government and our researchers have gotten it right and have chosen the proper vaccine to protect us from the flu. That doesn't happen all the time. But assuming that that is correct, it may protect us, and maybe the number of people who get the flu would decrease to only 2 to 4%. Interestingly enough, we always tell healthcare workers and students to get the flu vaccine. Would you be surprised to hear that there are really no good studies about healthcare workers and students? That's a fact. So when you ask your doctor about the flu vaccine, or when you're going to the store to get it, you need to ask some of the following questions. First of all, if you have an egg allergy, you might want to ask the doctor about how the flu vaccine is made. Some are now made in cultures, some are made based on eggs. If you have an egg allergy, you obviously want to stay away from the eggs. Some of the cultures were actually started from eggs, so you may want to stay away from that flu vaccine as well. Secondly, you want to ask if it's trivalent or quadrivalent. The quadrivalent may be better in children. But then I think we need to ask the question, what happens when you get the flu? What is the flu? The flu is influenza type A. It tends to be more severe than other viruses and other upper respiratory infections, but not always and not in everybody. If you think you might be getting the flu, by all means, please do call your doctor. And there are some medicines that can decrease the symptoms and perhaps decrease the length of time you're sick. But those are also no absolute guarantee. I think the point of this video is to tell you that nothing is set in stone and nothing is as it would appear. The media love for you to go spend your money on things that may or may not be important to you, the consumer. I'd like for you to go to a website, DrCure, that's QURE.com, where you can see databases about all kinds of medical queries. Who should get a hip replacement? What kind of a hip? What kind of cancer therapies might work in you as opposed to your neighbor? You know, healthcare is a science. It's not a guessing game. And many doctors, well, we just don't have the science, or we don't have the information ourselves to help you make those decisions. But there are places where we can go to get that information. And that's what I would like to share with you, the consumer, today. TheQure.com, QURE.com, a plethora of databases where you can go and ask your questions and have a company pursue your question with your specific answers about what treatment might work best for you. Healthcare is a choice. It's your choice, based on science, not on a guessing game. I invite you to go to The Cure and to visit Clinical Notebook again. Look through our video library, engage yourself, ask questions. Is this serious? Is this important to me? We'll try to answer those questions as best we can. And when we don't have the answer, we doctors need to go to The Cure as well and find the right answers. After all, healthcare is about you, the patient. Healthcare is a choice. And that choice is yours, not mine, not the government's, not your insurance plans. Thank you so much for enjoying this video, and we'll talk to you soon. Bye-bye now.